Welcome to the Denton Surgery Patient Group podcasts. The Denton Surgery Patient Group is a group of patients of Denton Surgery who work with the surgery to improve the patient experience. We are the patient's voice. Our other role is in running the volunteer patient transport scheme and in organising wellbeing meetings and events. This is number 3 in our series of podcasts. I am Kevin Hewitson, Secretary of the Denton Surgery Patient Group, and joining me today is Nicola, the practice manager, and Anish, who is the First Contact Physiotherapist. So Nicola, could you just tell us a little bit about your role at the surgery?
Yeah, so I'm the practice manager of the surgery. I've been here for about 12 or 13 years now. I've been practice manager for the past sort of 5 years.
Thank you. And Anish, just a little bit about introducing yourself. How long have you been at the practice?
I've been with the practice for about just over 4 years in different PCNs. So I have been, I've been with the practice for long enough, I guess. And I've been a physiotherapist for well over 25 years now, I believe. And so it's been a long time being a physiotherapist. Worked in various settings, including orthopedics, surgeries, and musculoskeletal physio in various advanced levels. So, a well-rounded set of experiences. I believe, hopefully.
I think we're very lucky to have you. Okay, so moving on to the focus of this podcast today, it is the role of the First Contact Physiotherapist. But just to start off with, Denton Surgery is part of a primary care network. And the primary care network is a group of practices which work together to improve the outcomes for patients. It also gives us access to a range of specialists to help in caring for those patients. So the PCN, the Primary Care Network, that we are part of is MWeb. And in addition to ourselves, this consists of Moulton Surgery, Woodview Medical Centre, Kingsthorpe Medical Centre and Wootton Medical Centre. Now, PCNs, as I've mentioned, give us access to a range of specialists. At Denton, we can now work alongside clinical pharmacists, care coordinators, social prescribers, paramedics, and of course our First Contact Physiotherapist. So, First Contact Physiotherapists, what are they and what can they do and what can they not do?
Okay, so First Contact Physio in UK general practice represents a significant evolution from traditional physiotherapy roles. With several key differences. So a first contact physio that you'll find in general practice, they tend to work as an independent practitioner within GP surgeries. Often they're the first point of call for patients with musculoskeletal complaints. The first contact physios can assess, diagnose and treat patients without prior GP referral or assessment. They have advanced clinical skills, including the ability to request imaging such as X-rays and MRIs, blood tests and other investigations. They can often prescribe certain medications and deliver injection therapies. They make onward referrals to specialists, other healthcare professionals or back to GPs when needed. They operate with extended scope of practice, so essentially functioning as a musculoskeletal specialist within primary care. And they help reduce GP workload by managing roughly 20 to 30% of GP appointments that are musculoskeletal related. Can
I just jump in there? Because that's quite a list, Nicola, isn't it? You know, people don't, I think, realise when they say physiotherapist or first contact physiotherapist, what actually is going on, if you like the iceberg, isn't it? You see a person and that's the contact that you have, but below that, there's a lot that they can do and going on in the background.
Yeah.
So comparing that then to the traditional physiotherapist that a lot of our patients, if you like, have a vision of or an idea of.
So traditional physiotherapists typically work in hospitals, community clinics or private practice. They usually receive patients via referral from GPs or other healthcare professionals. They focus primarily on treatment and rehabilitation rather than initial diagnosis. They can't independently request investigations or prescribe medications like our first contact physiotherapists in general practice can. They have more defined scope of practice centred on physical therapy interventions, and they may have specialisms, but generally they work within established treatment pathways.
So again, just trying to do a comparison between the two there. The traditional physiotherapist, to my layman's terms, seems to be already being directed to carrying out a set of treatments.
Yes.
Whereas the first contact physiotherapist is involved in a diagnostic route as well.
Yeah.
Yeah, I agree. I mean, to an extent. I mean, you know, like the traditional physiotherapists can diagnose independently and treat as well. It's where their setting is different. First contact being the first contact within a GP practice. That's the prime, or that's the main difference. I mean, like, and the traditionally the kind of traditional physiotherapists, they would, you know, like, be looking at doing a course of physiotherapy treatment in a hospital environment or a clinical environment as well. But the first contact physiotherapist predominantly will be just seeing the patient on the day, assess and diagnose the condition.
So we've got access to the first contact physiotherapist in the practice.
Mm-hmm.
So that's convenience. Yeah?
Yeah, so the main benefit of the role and the difference is the first contact physio, which we benefit from, was developed to improve access to musculoskeletal care, reduce waiting time. So it kind of eliminates the need for that wasted GP appointment because you're seeing a specialist from day one. That's the idea. And they provide appropriate first-line management of conditions like back pain, joint problems, sports injuries. They undergo a lot of additional training to develop the extended competencies that they have. And this model is particularly successful in reducing inappropriate referrals to secondary care as well, and provides patients with more direct access to specialist expertise such as Anish's.
Yeah, so from the patient voice that we get, where people have got a vision or an idea of a traditional physiotherapist, so when they think they're coming to see the physiotherapist, they think they're going to get what we describe in the left part
Mm-hmm.
of this description of the physiotherapist's role, instead of the first part, which was the more first point of contact. What's going on? How can I help you?
Mm-hmm.
What can I put into place for you?
Mm-hmm.
And how can I support you?
Mm-hmm.
That's a benefit, isn't it, really? Rather than the sort of longer route, which might mean a referral to the GP, from
Mm-hmm.
the GP to the hospital,
Mm-hmm.
time delays in waiting for appointments, and we know getting to hospitals and parking these days is not exactly easy for a lot of patients.
Mm-hmm.
So there's a lot of benefits here in speeding up the treatment process.
Exactly.
Although there's that sort of, if you like, dilemma or dichotomy between the older traditional view and this is an enhanced service.
Mm-hmm.
It is, yeah. It's
Yeah.
The idea is it reduces GP's workload. Typically, the first contact physios or the advanced practitioner physios, they are in a better position to diagnose and treat or manage musculoskeletal conditions in primary care. So that way you get an expert opinion earlier on, and a full circle of management can be done by the first contact physio
Right.
for a patient. Yeah.
So at this point, Nicola, do you think it'd be a good idea if Anish actually explained to us what a basic first contact experience would be like?
Yeah. So I would just give an idea how it works. So typically, say if you develop a pain, a musculoskeletal pain, or it could be like a neurological pain, like a sciatica, or some other conditions, anything to do with the muscles, bones, joints, or nerves, I should be able to assess and treat. It could be related to an injury, or it could be a pre-existing condition, or it could be something that happened with no particular reason at all. So then you would call the GP surgery as normal, and if there is an available appointment with myself, and the reception should be able to book you in for an assessment. And the consultation would typically involve a comprehensive assessment when I will be doing like a detailed history taking, just asking about how long it's been going on for, what kind of treatments have you tried already, any kind of relevant past medical history, present medical condition, things like that. And then I will be doing a comprehensive physical examination as well, like obviously looking at the joint range of movement, doing specialized orthopedic tests, maybe some neurological testing if that's appropriate, and we might have to obviously one thing to think about is like make sure you wear something appropriate, so that I can examine the joints correctly, like some loose fitting clothes and things like that would be beneficial. And based on the assessment, and we might be thinking about the management of the condition. So does it require any further investigation? Does it require some blood tests? Does it require some imaging, such as x-rays, MRI scans, or anything like that? Or is it something that's been ongoing, for example, a knee arthritis? Does it need an ongoing onward referral to an orthopedics? Yes, then I will be able to direct the patient accordingly, whether you make a referral or whatever is required at that stage. And sometimes it could be things such as education about the actual problem. It could be things like your advice regarding your posture, how to manage your condition, how to optimize your pain management strategies. And I will be able to prescribe medications as well if that is required, such as the pain management medication, or advise you on what kind of over-the-counter medications that you can use, and ideally self-management strategies as well at that stage. And once there could be situations where this multiple conditions might be causing ptosis pain, for example. A kidney stone might be causing a back pain. So if that's the case, I have the experience to rule that out in a way. Or if there are multiple issues that I'm not sure of, then I've always have the access to speak to the GP and then make appropriate treatment accordingly from there. So, and the other thing that I do is injection therapy as well. There's a number of conditions that can be injected, for example, arthritis, knee arthritis, or other different conditions like shoulder pain, tennis elbow, plantar fasciitis, different things I can provide injections, and most of the musculoskeletal injections I'll be able to do that here as well if it is appropriate.
That's a lot of time saving for the patient, whereas traditionally they would have had to go to secondary care for that, so that's excellent. Yeah.
That's correct, and that definitely would be an added advantage in the primary care. And you can expect at the end of the appointment, you can expect how to manage your condition, how to sort of do predominantly self-management. What are the other options? You might be taking some medications potentially, or you might be doing some investigations and things like that. So typically after the appointment, you will have a clear expectation or clear explanation of how to manage your condition.
Right. I mean, one of the things patients always feed back to us is that relationship between the patient and whoever they are seeing. And a lot of that depends on the patient being well prepared, I think,
yeah.
In a way in which they can clearly describe. So how best, Anish, could patients come to you? What preparation should they do?
I think it's basically like just writing down your symptoms might be beneficial, so that you explain that clearly. As sometimes it's quite easy to forget the details when you come in for an appointment, and things like when the problem started, what triggered it, was there an injury that caused it, Sometimes, I do have access to the full medical record, so I should be able to access all your medication and things like that. But if you have taken any over-the-counter medication and things like that, which I would be able to, or if you just let me know about that kind of, over-the-counter medication or anything else that you have taken for it, or again, how much this is affecting your work, your day-to-day activities and things like that. And then being honest and specific can be beneficial, like describe your pain levels accurately. You don't need to, you don't need to be brave, or you don't need to be extra brave about your pain levels, or you don't need to exaggerate your symptoms to taken seriously. I mean, I do assess you properly, and obviously, each person is different. Their pain tolerance and everything is different.
That's an interesting point. I mean, I've been asked describe your pain, and is it a tightness? Is it an ache? Is it a sharp? And it's difficult to come up, I think, with the vocabulary to describe pain.
Yeah. I mean, that's obviously coming to a medical appointment is always a tricky one. It is a stressful event for some people, but don't worry, I will be able to explain or make it as simple as possible in layman's terms. But if you don't know the name of your pain, don't worry, that's okay. I'm sure we can name it once I've gone through the assessment. That's absolutely fine. And physical examination, I think I've already said, just some loose fitting clothes, something that I can, so we can move the joints around and things like that. And do expect some pain when I move things around or when I press somewhere, because I'm quite skilled to actually feel the pain. So if I touch somewhere, it might be a painful spot. So don't worry, that's not harmful to you. Sometimes it can be a little bit achy when I'm touching, but if it is painful or anything that you beyond your management levels, do let me know so I can adjust my
screaming not advised.
And again, like I said, if you are not sure of something, do explain or ask me the questions, and I will be able to answer the questions. Anything that and you can write down things, and I often give like printouts, exercise sheets and things like that. And if I normally tend to go through the exercises with people if they're not sure of something, and I can demonstrate the exercises as well. And then so
can I just pick you up on that point, because I've experienced physiotherapy and been given a range of exercises, and the person's demonstrated them to me, but they've not watched me do it.
Okay.
So I felt as, am I doing it correctly?
Yeah.
And so having that opportunity to show it to the physiotherapist.
Yeah.
Is that something you take on board?
Absolutely. I mean, it is always a two-way approach. So if you are not sure of, I'm quite happy to go through that with you more than once. That's absolutely fine. And again, sometimes what I do is like we make a follow-up appointment a few weeks down the line or something like that. So if you're not sure of something, or if some of the exercises had given you some issues, for example, then you can let me know when you come back for the follow-up appointment, and then we can alter it or go through that again if that is required.
I got the offer of videoing using my phone.
Oh yeah.
The actual exercises of the physiotherapist I saw was quite happy to say, well, look, if you've got your phone with you, I'll video you doing it, so you can watch it later.
Yeah, and I mean that's okay. If you want to do something like that, that's okay. I mean, we're a little bit limited in the primary care because we don't have all the equipment in here, and we work within the clinical rooms as well. And sometimes when you go to the physio at the hospital, they can do like tailor-made exercises. They've got like we've got special softwares for that, but which we don't have access to that in primary care. But I tend to provide with some pictures and written explanation of the exercises as much as possible.
Yeah. Oh, brilliant. Well, that was quite informative. The outcome of this is not instant, is it? It's a process.
So,
This idea of going to see the physiotherapist and I walk out and it's fixed and I'm going to be fine. You mentioned follow-up appointments, so that's not to be not expected, as it were. It's not a one visit fix.
Yeah, absolutely. I mean, I think one thing, what I would say, don't expect like a hands-on massage when you come to see me. I mean, that's not this role is for. I mean, this is to sort of, assess and diagnose your treatment. But if you need like an ongoing set of physiotherapy, I will be referring you on to the physio at the hospital, which they have more capabilities of doing that. With the, if I am starting to see people on a routine basis, I don't think we can sustain the service like that with the time that we have here. So the expertise is to sort of assess, diagnose, and manage your symptoms as much as possible, which I think we have been doing that successfully for a few years. I mean, probably won't be up to the expectation of everyone from a physio point of view, but I think the role is based on this expert service rather than traditional hands-on physio treatment.
Yeah, that's exactly right.
Yeah. So it's seen it almost at the beginning of a journey, isn't it?
Absolutely, yeah.
Journey which may be satisfied here, but if
may
necessary,
not as
well. Can progress.
Yeah.
And it's not preventing you having access.
No.
Absolutely.
To if
it's
you like,
actually supporting that, and it's to eliminate that wasted appointment with a GP who's not actually a musculoskeletal specialist.
Yeah, I was going to ask you a term there that you used, a neurological assessment.
Yes, yeah. I mean, the neurological, what that means is like, in human body, everything is interconnected. I mean, like, obviously you need nerves to work on the muscles, and you need the bones and joints, the ligaments, they're all interconnected. So if somebody presents with a particular condition, then I'll be looking at, or is it related to a nerve problem? So that's where the neurological assessment comes in. So it could be such as like, for example, a sciatica or a weakness of some sort, then I'll be looking at like a neurological assessment. So there are a few different things that I do with that will be testing your sensation, testing your muscle power. Could be things like your, like a sharp sensation, hot and cold sensation, different things like that. So that's the neurological assessment.
Right. Well, thank you for explaining that. Nicola, is there anything that you want to add to what Anish has said there? Or shall we move on to what can patients do if they are not making progress through this approach?
Yeah. Okay, I think the best thing to do is, if you feel that it's not met your expectations or you're not sort of progressing as you thought, the best thing to do is speak to Anish first. Many issues can be resolved through that kind of communication with the actual specialist. That's your first port of call. You could always request to see a GP for a second opinion or an alternative management approach. You could contact myself as the practice manager to discuss any concerns that you might have. Obviously, Anish would be picking up whether a referral to physiotherapist therapy services in secondary care might be appropriate. There's also private physiotherapy treatment for that kind of more sustained treatment. If it's not getting better, that might be advisable. It's important to distinguish the difference between the treatment outcomes of seeing a first contact physio and this idea of the traditional physiotherapy course. So we have found that some patients think that they receive a course of treatment here, and as Anish has explained, we don't have the capacity to do that in general practice. The idea of this role is for the initial diagnosis and management.
Yeah. I think I read somewhere that that initial phase can satisfy quite a high proportion of the issues, if you like.
Yes.
And I think it was about 60 to 70% I read somewhere.
Absolutely. I think the idea is, when before these first contact physios were not in the primary care, like everything was going to the GPs. obviously, GP's workload is a big issue, and the other thing is, GPs can always they can direct their attention to other matters which can be more complex and things like that. So the musculoskeletal conditions, when you go like an expert in that field available in the primary care, that reduces that traffic towards the GP and overall improves. And like you said, 60 to 70% or even more than that can be managed within primary care, following this approach.
And I think I said earlier that it does roughly generally free up about 20% of GP's time, 20 to 30%. So that's giving them time to deal with complex mental health issues.
So there's a broader benefit,
absolutely.
Not just to the patients who are seeing the first contact physiotherapist, but the rest of the patients in the community who have now got more GP access time.
And Anish is very well utilised in the practice. It shows how much musculoskeletal kind of issues there are. He's fully booked. He's here 2 days a week, and your clinics are chocker, aren't they?
Yeah, so they're normally quite.
We're all falling apart, are we?
Hopefully not. No. But there's obviously a few practical constraints too. So limited appointment slots in the surgery mean that First Contact Physios can't provide this 6 to 8 week treatment course that people generally expect from a physiotherapist. So the role is just to manage the initial contact efficiently, direct patients to appropriate ongoing care, and obviously Anish needs to maintain that availability for new referrals rather than providing extended follow-up care, which can be better placed in secondary care. But obviously we've been trying to manage this kind of expectation. We've worked together on it as a patient group. We've sort of done posters. We've done some posters on and some posts on Facebook, and that's obviously doing this podcast today will help kind of get that message out about the difference as well. But that's kind of everything I wanted to say about the difference between the two roles.
Well, I'm sure people will still have questions, and as a patient group, we are there to listen as well, and offer that voice to the surgery. So it's probably something which will be part of the range of tools we can use to help inform patients about how the first contact physiotherapist works within the practice. So many thanks today, Anish, for taking part. I hope we haven't sort of put too much pressure on you today. And thanks again, Nicola, for inviting us in to talk about what is obviously a very important topic. It's come up a lot with the Denton Surgery Group. So if you want to know anything more about the Denton Surgery Patient Group, what we do, our role and how we get involved, then perhaps even volunteer to be one of our drivers, then you can contact us by email at secretary.dspg.me, or you can see the notice board in the surgery for a list of numbers and contacts that you can use. Well, I hope you've enjoyed our podcast, and I hope you will join us next time. When? Well, we haven't decided, and we haven't decided on the topic yet. We'll wait and see what the patients want to find out about. Thank you very much.
Thank you.
Thank you.